There are four basic pathologies that can cause glenohumeral joint hypomobility, and those causes are listed here: rheumatoid arthritis, osteoarthritis, prolonged immobilization, idiopathic frozen shoulder. Today I will tell you all about frozen shoulder. First of all, age onset of frozen shoulder is between 40 and 60 years. Now we will discuss common structural and functional impairments related to frozen shoulder. First and foremost is night pain and disturbed sleep, pain on moving extremity and often at rest. Mobility, decreased range of motion, usually limiting external rotation, and abduction with some limitation of internal rotation. External rotation is limited, abduction is limited, internal rotation is limited, inflection, elevation is limited in flexion. Presentation of patient with frozen shoulder be like protracted and interiorly tilted scapula, rounded and elevated shoulders, arms swing during gait is decreased. Now we will discuss activity limitations associated with frozen shoulder: inability to reach overhead, behind head, out to the side and behind back. Difficulty dressing, putting on a jacket or coat, fasting, reaching hand into back pocket of pants to retrieve wallet, brushing teeth, washing face, bringing eating utensils to the mouth. Difficulty lifting weighted objects such as dishes into a cupboard. Cannot perform repetitive activities. Now, stages of frozen shoulder. Stage 1 is associated with pain that increases with movement, present at night, loss of external rotation motion. Second stage is freezing stage and characterized by persistent and more intense pain even at rest. Motion is limited in all directions and cannot be fully restored with an intra-articular injection. This stage is typically between 3 and 9 months. I said don't forget about the duration of a stage. Stage 1's duration is less than 3 months, and the duration for stage 2 is 3 and 9 months. Between 3 and 9 months. And stage 3, frozen stage, characterized by pain only with movement, significant adhesions, and limited glenohumeral motions with substitute motions in the scapula, atrophy of the deltoid, rotator cuff, biceps, triceps, rib, and most of the muscles of shoulder girdle joint may be noted. This stage is between 9 and 15 months. And now it's turn for stage 4, that is sawing stage, characterized by minimal pain and no synovitis but significant capsular restrictions and adhesions. Motion may gradually improve during this stage. This pain lasts from 15 to 24 months or longer. Some patients never regain normal range of motion. Some references indicate that spontaneous recovery occurs on average 2 years from onset, although other